Hash the top 200 drug rap. 200 drugs, but we learn them by class, generic in the front, brand name in the back. Use and side effect, put the facts on the track, hear it, say it, repeat it, then the answers come back. Generic, brand, class, side effect, match 4 pieces and earn that check. Suffix gives a clue, but confirm the name. Learn drugs in families to master the game. Lisinopril, Zestril, ACE lowers pressure, dry cough, high potassium, monitor the measure. Losartan Iskazar, an ARB in the plan, drops blood pressure without the cough of a poor man. Valsartan, Diovan, heart failure and BP, watch potassium and kidneys, that's the key. Amlodipine, Norvasc, calcium channels get blocked, pressure comes down, but the ankles may swell up. Metoprolol, low pressure, or Toprol XL, slows down the heart, check the pulse as well. Carvedilol, Coreg, blocks beta and alpha, heart failure support, but dizziness can follow. Atenolol, Tenormin, makes heartbeats slow, bradycardia and fatigue are the effects to know. Propranolol, Inderol, tremor and migraine, also lowers pressure, but asthma may complain. Diltiazem, Cardizem, slows rhythm and rate, constipation and bradycardia, monitor the state. Verapamil, Colon, controls pressure and rhythm, constipation's the classic, remember it with him. Pro brings a cough, Sartan blocks the strain, Dipine swells ankles, Olol slows the frame. Generic, brand, class, side effect, match 4 pieces and earn that check. Hydrochlorothiazide, Microzide, thiazide flow, lowers pressure, lowers sodium, potassium mago. Furosemide, Lasix, a powerful loop, loses water and potassium, dehydration in the group. Spironolactone, Aldactone, potassium stays, hyperkalemia and breast tenderness may raise. Hydralazine, apresyline, arteries relax, headache, fast heartbeat, lupus with prolonged tracks. Clonidine, Catapress, calms sympathetic tone, sedation, dry mouth, don't stop it on your own. Nitroglycerin, Nitrostat, angina right now, headache and low pressure, sit the patient down. Isosorbide mononitrate, Imgur for prevention, long-term angina control, nitrate-free interval attention. Sacubitril/valsartan, Entrasho for the heart failure combination, ACE drugs must stay apart. Digoxin, Lanoxin, strengthens cardiac squeeze, toxicity means nausea, yellow vision, arrhythmias with ease. Amiodarone, Pacerone, rhythm under control, but lungs, liver, thyroid, eyes, monitor the whole. Warfarin, Coumadin, anticoagulant king, bleeding risk, monitor INR, that's the main thing. Apixaban, Eliquis, factor Sol gets blocked, bleeding is the danger when the pathway gets locked. Rivaroxaban, Xarelto, another SAW name, treats and prevents clots, bleeding risk the same. Dabigatran, Pradaxa, thrombin gets denied, keep it in the original bottle, bleeding on the side. Enoxaparin, Lovenox, low molecular weight heparin, injection anticoagulant, bleeding may appear again. Clopidogrel, Plavix, platelets cannot stick, bleeding and bruising, antiplatelet trick. Ticagrelor, Brilinta, after ACS or stent, bleeding and shortness of breath may be the event. Aspirin, Bayer or Recadrin, platelets get restrained, GI irritation and bleeding are commonly named. Atorvastatin, Lipitor, LDL goes low, muscle pain and liver injury are the risks to know. Rosuvastatin, Crestor, cholesterol control, myopathy and liver enzymes, monitor the goal. Simvastatin, Zocor, LDL gets checked, muscle pain rises with interacting drugs, inspect. Pravastatin, Bravacol, another statin line, watch muscle aches and liver signs over time. Ezetimibe, Zetia, blocks absorption in the gut, may cause muscle pain, but cholesterol gets cut. Fenofibrate, Tricor, triglycerides fall, added to a statin and myopathy may call. Metformin, glucophage, first-line type 2, GI upset early, lactic acidosis is rare but true. Glipizide, glucotrol, insulin release goes high, hypoglycemia is the danger, meals should stay nearby. Glyburide, diabeta, another sulfonylureabete, low blood sugar risk, especially when patients do not eat. Glymiviride, Amriel, lowers glucose all day, hypoglycemia and weight gain may come into play. Pioglitazone, Octos, insulin sensitivity grows, edema and heart failure, avoid when swelling shows. Sitagliptin, Januvia. DPP4 gets blocked. Joint pain or pancreatitis should not be overlooked. Linagliptin, Tradjenta. DPP4 in the mix, usually weight neutral. Pancreatitis is a risk. Empagliflozin, Jardiance, glucose leaves in P. Genital infections and dehydration are the key. Dapagliflozin, Farxiga, heart and kidney aid, but urinary infections and ketoacidosis make the grade. Canagliflozin, Invokana, glucose flows away. Watch dehydration and genital infections every day. Semaglutide, Ozempic or Ribelsis by name, lowers sugar and appetite, nausea joins the game. Dulaglutide, Trulicity, weekly GLP-1, nausea and slowed digestion, weight may come undone. Liraglutide, Victoza or Saxenda in view, diabetes or weight management, nausea may pursue. Insulin Glargine, Lantus, long-acting through the night, hypoglycemia is the danger if the dose is not right. Insulin Lispro, Humalog, rapid with the meal, low sugar comes quickly, timing must be real. Insulin Aspart, Novolong, another rapid friend, eat when it is given or glucose may descend. Chorus. Gliptin saves incretin, gliflozin makes glucose flow, glutide slows the stomach and appetite goes low. Insulin can save, but too much drops the floor. Check the dose, check the meal, then check it once more. Levothyroxine, Synthroid, thyroid replacement sound, too much brings fast heartbeat, take it with no food around. Alendronate, Fosamax, protects the bone, sit upright with water, esophagus must be shown. Ibandronate, Boniva, osteoporosis care, upright after dosing, jaw problems are rare. Resedronate, Actonel, helps bones resist, take with plain water and follow the upright list. Calcitriol, Recaltrol, active vitamin D, calcium may rise too high, watch for toxicity. Amoxicillin, Amoxil, penicillin attack, allergy, rash, diarrhea, those are facts. Amoxicillin/clavulonate, augmentins the name, diarrhea is common, but beta-lactamase gets tamed. Penicillin V, Vetids, classic infection fight, allergy and stomach upset are warnings in sight. Cephalexin, Keflex, first generation Kef, rash and diarrhea, check allergies before the step. Cefdinir, Omnicef, cephalosporin oral, iron may turn stools red, strange but usually normal. Cefurazine, Ceftin, respiratory infection aid, GI upset and allergy are the warnings displayed. Ceftriaxone, Rocephin, third generation shot, biliary sludge and diarrhea or risks it has got. Azithromycin, Zithromax, the famous Z-Pack, QT prolongation, check the rhythm track. Clarithromycin, Biaxin, macrolide in line, metal taste, drug interactions, QT warning sign. Doxycycline, Vibramycin, tetracycline sun, photosensitivity, shade yourself when outside fun. Minocycline, Minocin, acne and bacteria fight, dizziness and skin discoloration may come to light. Ciprofloxacin, Cipro, fluoroquinolone name, tendon rupture and nerve damage raise the warning flame. Levofloxacin, Levaquin, another floxacin clue, tendons, QT, nerves, serious warnings too. Trimethoprim/sulfamethoxazole, Bactrim on the shelf, sulfan allergy, rash, high potassium, check the patient's health. Metronidazole, Flagyl, anaerobes go down, no alcohol with Flagyl, keep that rule around. Clindamycin, Cleocin, bacteria lose the fight, but C. difficile diarrhea is the warning in sight. Nitrofurantoin, Macrobid, urinary tract defense, take it with food, lung injury is rare but intense. Vancomycin, Vancomycin, serious gram-positive care, kidney injury and infusion flushing, monitor there. Linezolid, Zyvox, resistant bacteria fall, serotonin syndrome and low platelets may call. Acyclovir, Zovirax, herpes under attack, hydration protects kidneys, keep fluids on track. Valacyclovir, Valtrex, herpes treatment too, headache and nausea are common effects in view. Oseltamivir, Tamiflu, influenza gets slowed, nausea and vomiting may travel down the road. Fluconazole, Diflucan, fungal cells get hit, liver injury and interactions, do not forget it. Ketoconazole, Nazoral, antifungal strong, liver toxicity and interactions can go wrong. Nystatin, Mycostatin, thrush gets cleared away, swish and swallow or spit as directions may say. Achilline and kef make bacteria retreat, fluoxetine hurts tendons, cyclin fears heat. Azole attacks fungus, Vir fights viral strain, brand and generic Ecotil they stick inside the brain. Fluoxetine, Prozac, SSRI in the zone, nausea, insomnia, sexual effects are known. Sertraline, Zoloft, depression and anxiety care, GI upset and sexual dysfunction may be there. Escitalopram, Lexapro, anxiety gets seized, QT risk at higher exposure, sexual effects may be seen. Citalopram, Celexa, serotonin goes higher, QT prolongation is the warning to remember and acquire. Paroxetine, Paxil, anxiety and depression aid, weight gain, withdrawal, sexual effects displayed. Venlafaxine, Effexor, SNRI with drive, blood pressure may rise, withdrawal can arrive. Duloxetine, Cymbalta, depression plus nerve pain, nausea and liver warnings join the refrain. Bupropion, Wellbutrin, also Zyban to quit, less sexual dysfunction, but seizures are the risk. Trazodone, Deserol, often used for sleep, sedation and priapism are warnings to keep. Mirtazapine, Remeron, helps sleep and appetite, weight gain and drowsiness may show up overnight. Amitriptyline, Elavil, TCA in the song, dry mouth, sedation, heart rhythm may go wrong. Buspiro, Buspar, non-benzo anxiety care, dizziness takes time, instant relief is not there. Alprazolam, Xanax, benzodiazepine calm, sedation, dependence, combine with opioids, alarm. Lorazepam, Ativan, anxiety and seizure aid, sedation and dependence are the dangers displayed. Diazepam, Valium, long-acting relaxation, drowsiness and falls, plus respiratory depression. Clonazepam, Klonopin, panic and seizures restrained, sedation and dependence are commonly named. Zolpidem, Ambien, sleep comes through the night, complex sleep behaviors, driving without full sight. Quetiapine, Seroquel, atypical antipsychotic flow, weight gain and sedation are effects to know. Olanzapine, Zyprexa, controls psychotic strain, major weight gain, glucose and lipid gain. Risperidone, Risperdal, psychosis gets controlled, prolactin elevation and DPS may unfold. Aripiprazole, Abilify, dopamine gets tuned, akathisia makes patients restless around the room. Haloperidol, Aldol, typical psychotic care, EPS and QT prolongation, watch with care. Lithium, Lithabit, bipolar mood and line, kidneys, thyroid, tremor, keep levels in design. Phenytoin, Dilantin, seizure control plan, gingival hyperplasia, floss whenever you can. Levetiracetam, Keppra, seizures held at bay, mood changes and irritability may enter the day. Lamotrigine, Lamictal, seizures and bipolar fight, serious rash and SJS, reported on site. Carbamazepine, Tegretol, seizures and nerve pain, low sodium, blood disorders, interactions in the chain. Devalpro X, Depakote, seizure and mood defense, liver damage, pancreatitis, pregnancy risk intense. Topiramate, Topamax, migraine and seizure tool, cognitive slowing, kidney stones, stay hydrated and cool. Gabapentin, Neurontin, nerve pain's common friend, drowsiness and dizziness may follow to the end. Pregabalin, Lyrica, nerve pain on the list, dizziness, edema, weight gain may persist. Carbidopa/levodopa, Cinemet, Parkinson's relief, nausea and involuntary movements may bring grief. Ropinirole, Requip, Parkinson's and restless legs, sleep attacks and impulse problems may raise red flags. Donepezil, Aricept, Alzheimer's memory aid, nausea, diarrhea, slow heartbeats displayed. Memantine, Namenda, NMDA gets restrained, dizziness and confusion may sometimes remain. Sumatriptan, Imitrex, migraine attack gets hit, chest pressure and vessel constriction, heart disease may not fit. Rizatriptan, Maxalt, migraine relief is fast, avoid excess use or rebound headaches may last. Acetaminophen, Tylenol, fever and pain decrease, too much harms the liver, dose with care, please. Ibuprofen, Advil or Motrin, NSAID in command, stomach bleeding and kidney stress go hand in hand. Naproxen, Aleve, inflammation goes low, GI bleeding and higher pressure are risks to know. Celecoxib, Celebrex, COX-2 pain relief, heart risk and kidney injury can still bring grief. Meloxicam, Mobic, once daily NSAID name, GI bleeding, kidney injury, warnings stay the same. Diclofenac, Voltaren, topical or oral pain, Heart, stomach, liver warnings join the chain. Ketorolac, Toradol, strong short-term NSAID play, 5-day limit, bleeding and kidneys can pay. Tramadol, Ultran, opioid-like pain control, seizures and serotonin syndrome take their toll. Hydrocodone/APAP, Norco for the pain, breathing slows, acetaminophen can injure the liver again. Oxycodone/APAP, Percocet on the chart, sedation, constipation, breathing may depart. Oxycodone, OxyContin, extended release strong, do not crush, dose dumping can go dangerously wrong. Morphine Mississippi Contin, opioid pain relief, respiratory depression and constipation bring grief. Hydromorphone, Dilaudid, very potent dose, mix-ups with morphine can lead to overdose. Fentanyl, Duragesic, potent patch in place, only opioid-tolerant patients, overdose can race. Methadone, Methadose, pain or care, QT prolongation and breathing risk are there. Naloxone, Narcan, wakes breathing from the fall, give it, call 911, and stay through it all. Buprenorphine/naloxone, Suboxone treatment track, for opioid use disorder, withdrawal may attack. Cyclobenzaprine, Flexeril, muscle spasm slows, sedation and dry mouth are effects to know. Baclofen, Liorsal, spastic muscles release, do not stop abruptly, seizures may increase. Dizanidine, Xanaflex, spasticity comes down, sedation and low pressure may spin things around. Methocarbamol, Robaxin, muscle relaxation line, drowsiness and dizziness, avoid driving time. Omeprazole, Prilosec, stomach acid gets blocked, long-term low magnesium and fracture risk get clocked. Pantoprazole, Rotonix, another PPI name, headache and long-term deficiencies join the game. Lansoprazole, Prevacid, acid production restrained, long-term infection and mineral risks are named. Esomeprazole, Nexium, reflux under control, low magnesium long-term may take a toll. Famotidine, Pepcid, H2 receptors get blocked, headache or confusion in older patients may be clocked. Sucralfate, Carafate, coats in ulcer wall, constipation and drug-binding interactions may call. Ondansetron, Zofran, nausea gets denied, QT prolongation is the warning on the side. Promethazine, Phenergan, nausea and allergy care, heavy sedation and tissue damage if injected wrong there. Metoclopramide, Reglan, stomach movement gets strong, tardive dyskinesia if used too long. Dicyclomine, Bentyl, IBS spasms decline, dry mouth and blurred vision, anticholinergic sign. Loperamide, Imodium, diarrhea slows down, overdose can harm the heart, do not exceed what is found. Polyethylene glycol, MIR-LAX draws water in, bloating and loose stools are where effects begin. Lactulose, Anulose, constipation and ammonia care, gas and diarrhea may show up there. Bisacodyl, Dulcolax, stimulant laxative push, cramping and diarrhea when the bowel gets rushed. Albuterol, Ventolin or Pro-Air rescue breath, tremor and fast heartbeat are effects you may get. Budesonide, Pulmicort, inhaled steroid control, rinse the mouth for thrush prevention, that is the goal. Fluticasone, Flonase or Flovent by route, nasal irritation or oral thrush may sprout. Montelukast, singular, leukotrienes get blocked, mood and behavior warnings should not be overlooked. Ipratropium, Atrovent, airways open wide, dry mouth is the classic anticholinergic side. Tiotropium, Spiriva, long COPD control, dry mouth and urinary retention may take a toll. Fluticasone/salmeterol, Advair controller pair, rinse after use, it is not for an acute attack there. Budesonide/formoterol, Symbicort on the scene, controller combination, rinsing keeps the mouth clean. Cetirizine, Zyrtec, allergies calm down, some drowsiness may still come around. Loratadine, Claritin, less sleepy relief, headache and dry mouth may bring minor grief. Fexofenadine, Allegra, antihistamine aid, fruit juice can reduce absorption, water is preferred instead. Diphenhydramine, Benadryl, allergies and sleep, sedation and anticholinergic effects run deep. Pseudoephedrine, Sudafed, congestion clears away, pressure and heart rate may rise during the day. Oxymetazoline, Afrin, nasal vessels constrict, 3 days only or rebound congestion gets thick. Benzonatate, Pesolon, numbs the cough reflex line, swallow whole, chewing numbs the mouth and airway over time. Guaifenesin, Mucinex, mucus gets thin, Drink plenty of water to help it begin. Tamsulosin, Flomax, prostate urine flows, dizziness and low pressure are effects to know. Finasteride, Broskar, prostate slowly shrinks, sexual dysfunction may occur as testosterone conversion sinks. Dutasteride, Avodart, shrinks prostate size, sexual side effects may arise. Oxybutynin, Diazepan, bladder urgency slows, dry mouth and constipation, anticholinergic loose. Solifenacin, Vesicare, bladder spasms retreat, dry mouth and constipation repeat the beat. Sildenafil, Viagra, Parade 5 in command, never mix with nitrates, blood pressure cannot stand. Tadalafil, Cialis, lasts longer in the frame, nitrates are forbidden, back pain may join the game. Latanoprost, Zalatan, eye pressure goes low, darkens iris color and makes eyelashes grow. Timolol eye drops, Timoctic, beta blockade in the eye, slow heart rate or breathing problems may apply. Buramonidine, Alphagon, lowers pressure with ease, dry mouth and fatigue are effects patients may see. Dorzolamide, Trusopt, carbonic enzyme denied, burning in the eye and bitter taste on the side. Estradiol, Estrace, estrogen replacement care, clots and cancer risks require caution there. Conjugated estrogens, Premarin in the plan, clot and cancer risks, use the lowest dose you can. Medroxyprogesterone, Provera or Depo shot, irregular bleeding and bone loss are risks it has got. Norethindrone, Micronor, progestin only pill, take it same time daily for effectiveness still. Ethanylestradiol/levonorgestrel, Aviane combined, clot risk rises with smoking, especially after 35. Testosterone, Androgel, hormone replacement troll, wash hands, prevent transfer, monitor blood count control. Prednisone, Deltazone, inflammation goes low, high sugar, infection, weight gain with prolonged flow. Methylprednisolone, Medrol, steroid inflammation care, mood changes and immune suppression may appear. Dexamethasone, Decadron, potent steroid name, high glucose and infection risk remain the same. Methotrexate, Trexel, autoimmune and cancer aid, weekly for many conditions, daily errors can be grave. Hydroxychloroquine, Plaquenil, lupus and RA relief, retinal toxicity means eye exams underneath. Allopurinol, Xyloprin, prevents uric acid rise, serious rash means stop and seek advice. Colchicine, Colchris, acute gout flare gets cooled, diarrhea is common, overdose is cruel. Ferrous sulfate, Thiazole, iron builds blood, constipation and dark stools come with the flood. Potassium chloride, Chloroquine, potassium restores, never crush extended release, high potassium brings cardiac wars. Magnesium oxide, Magox, supplement and bowel aid, diarrhea is the common trade. Folic acid, Folvite, supports red blood cell creation, used in pregnancy and methotrexate supplementation. Cyanocobalamin, vitamin B12 in the line, treats B12 deficiency and supports nerve design. Ergocalciferol, Drizidol, vitamin D2 supplied, too much raises calcium, toxicity can arrive. Cholecalciferol, vitamin D3 for the bone, excess causes high calcium and kidney stones. Epinephrine, EpiPen, anaphylaxis must fall, inject outer thigh, then immediately call. Generic first, brand name next, class and warning form the text. Real coughs, Olol slows, gluflozin makes the glucose flow. Statin means muscle, cyclin means sun, azole fights fungus till the infection is done. Opioids stop breathing, insulin drops sugar, anticoagulants bleed, check every number. 200 drugs, now the families connect, name, brand, class, side effect. Read it, wrap it, cover and recall, one class at a time, you can master them all.